If you are diabetic or pre-diabetic and you need diabetic services, but you need to make your dollar stretch no further than the Maria Holder Diabetes Center. For vascular, podiatry and diabetic eye screening services or consultations with diabetes doctors and nurses, call 417-0305 today. The Maria Holder Diabetes Center, located in Warren, St. Michael. They can save your life and save you money. But members get 10% off.
Good afternoon to you, and everyone listening to 100.7 QFM. The next 15 diabetic-friendly minutes you hear on your radio could possibly add years to your life when you hear the health tips which are being brought to you with the compliments of the Barbados Diabetic Eye Screening Program, the Barbados Community Foundation, and the Maria Holder Diabetes Center. This is Peter Boyce here, and if you are diabetic or pre-diabetic, the Maria Holder Diabetes Center located in Warren, St. Michael is one place that you should be visiting often. They are located right behind Eunice Gibson Polyclinic. You can't miss it. One of the services which they offer is diabetic eye screening. Wait, stop the music! Stop the music! There's a serious conversation here. If you are diabetic, have you had your annual eye screening for diabetic retinopathy yet? Listen, don't play with your eyes here. We want that when you go to queue in the community that you can see all the pretty dressed people and participate in all the games. That's why you need to get your eye screened. Listen to what Dr. Charles Pierce, clinical lead of the Barbados Diabetic Eye Screening Program, has to say about eye screening.
Our main focus is at this time is the eye care. We've started a screening program and we're trying to emphasize again that people need to come and have annual checks to see if there are any changes related to diabetes in their eyes, and we're trying to pick those changes up before they cause problems. So before you start noticing any change in your vision or any other problems with your eyes, we can pick up these diabetic changes and act on it, whether that's going to need treatment, referral, or closer monitoring. Everyone over the age of 12 with a diagnosis of diabetes should be having screening checks at least every year. If there are problems found, then we might need to see you more often than every year.
Thank you, Dr. Charles. So you hear what the doctor say, right? Call and make that appointment to get your eye screen. 243-3937. And that's just one of the services you can find at the Maria Holder Diabetes Center, and you're going to hear about all those services inside of this show. But right now, let me focus on food. 1:30 not too long gone. You eat your lunch for the day yet? Did you have a healthy lunch? Do you even know what a healthy lunch looks like? Well, we will malicious today and go to the Diabetes Foundation and find out what Ingrid has in her lunchbox.
Hi guys, welcome back to this segment of What's in My Lunchbox. My name is Ingrid.
Hi Ingrid!
And I am a medical receptionist here with the Diabetes Foundation. Today what I'm having for lunch is some baked chicken with the skin off, with some sweet potato, a very small amount of sweet potato for carbohydrate, for energy. And I'm also having my specialty salad. My salad consists of carrots, black beans, corn. It has some romaine lettuce in it as well. It also has some almonds on it, to make it nice and tasty. And then for snack, I'm having one apple. You know what they say about an apple? Having an apple a day keeps the doctor away. So that's it. And my 32 ounce of water. That's what I'm having for lunch today. Thank you, guys.
Thank you, Ingrid, for letting me malicious and find out what a healthy lunch looks like. So all the people listening to QFM, you hear what a healthy lunch is? Salad with black beans and things. And you notice Ingrid did not say anything about sweet bread. Because I know I have a lot of sweet breaders out there, people who like eating sweet bread. I ain't a sweet bread, but I like eating sweet bread bad. So especially if you are diabetic, or even if you aren't, let's hear what dietitian with the Maria Holder Diabetes Center, Victoria Cox, has to say about sweet bread eaters.
Most of us enjoy sweet bread, but of course, as the name implies, it is sweet and it is bread. So undoubtedly, it is something to be particularly mindful of, especially for those living with diabetes. The sweetbread is going to be made with some kind of flour, so that alone as a base is going to, digest into glucose or sugar and have an effect on the blood sugar. And then, of course, the sugar itself in the sweetbread and any dried fruits or what have you that may be in there is going to have more of a spiking effect on the blood sugar. So, it's one of those things where my suggestions are you don't want to have it often and you don't want to have it in perhaps a particularly large portion. And, some people will play around with making slightly healthier versions themselves at home. And then, so different ideas are to perhaps use a higher fiber flour, whether that be just regular, wheat flour, but whole wheat, or oat flour, or add oats, part oats, part flour. People will just use different types of alternative flours like cassava flour, whatnot. You can also increase the fiber content by adding things like ground flaxseed or chia seed into the mixture. Then just playing around with cutting down on the amount of sugar used in general. But of course, for it to still end up tasting like sweetbread, there's usually some sugar still. And it's important to remember that the alternative flours, the high fiber flours, are themselves still carbohydrates. So they will still digest into sugar, albeit perhaps more slowly than regular white flour. And of course, if you make your sweetbread with less sugar, again, it's better than a full sugary version, but you just don't want to fall into the trap of, because my sweetbread is healthier, I can eat 2 or 3 slices instead of 1. You still want to practice portion control and being smart with even your healthier homemade versions. And it's important to remember that, switching from sugar to honey, for example, is still a type of sugar. So it's not that makes it sugar-free because you've used honey or maple syrup or agave. Those, as well as dried fruits, all still have sugar. So you do want to be mindful. So by all means, play around with a healthier, higher fiber, lower sugar alternative, but still be mindful of portion control at the end of the day.
Thank you, Victoria, dietitian who you can call and make an appointment with at the Maria Holder Diabetes Center, as we go from a sweet bread segment to a sweet QFM song of the day. Just so you know, Sweet Kisses does not raise your sugar levels. Maybe we should chat with Victoria on that. A song that you can dance to on the roof deck. The Drifters, Sweets for My Sweet. Compliments, the Maria Holder Diabetes Center. Get on your feet and dance.
If you want it, the star that shines so brightly to match the stardust in your eyes, darling, I would chase that bright star nightly and try to steal it from the sky, 'cause I will give sweets for my sweets, sugar for my honey, your tasty kiss thrills me so. Sweets for my sweets, sugar for my honey, I never ever let you go.
Most of us enjoy sweetbread.
The Maria Holder Diabetes Center.
And if you needed a dream to keep you smiling, I'll tell the Sandman you were blue, and I'll ask you to keep that sand a piling till your dreams would come true, 'cause I will give sweets for my sweets, sugar for my honey, your tasty kiss thrills me so. Sweets for my sweets, sugar for my honey, I never ever will let you go.
A brand new service which we can be proud of is now available at the Maria Holder Diabetes Center. Vascular or ABI screening. Who should get a vascular screening? Persons living with diabetes or persons who experience pain or burning sensation in their legs or toes, especially while they are resting. This is normally referred to as bad circulation. Book your vascular or ABI screening test today by calling the Maria Holder Diabetes Center 243-3937 to get more information and make an appointment. Board members get 10% off.
It's time to focus on your feet, ladies and gentlemen. Have you taken your feet to the Maria Holder Diabetes Center to podiatrist Louise Robinson recently? You need to do that. And also, do you know that what you wear on your feet matters? Look at your feet. When you hear what Dr. Diane Braffett has to say about diabetics wearing the correct footwear, You might throw away the shoes that you wear right now.
Hi, Dr. Brathwaite here again with you.
Hi, Dr. D.
What you wear on your feet matters. The main reasons that we see people presenting with bruises and calluses and ulcers in our clinic is actually incorrect footwear, also followed by callus and high pressure areas that are not properly managed. Other than common conditions, we'll also be talking about how to take care of the feet and how to consider choosing footwear. And if you have a dressing or a wound, how to take care of your feet. I want to just highlight some main points, however, in relationship to foot care. Number one, if you have diabetes and you notice a significant change in your feet, or you have a bruise, a problem with your nail or ulcer, please seek medical attention. If you have a puncture wound, you have to understand that puncture wounds are actually what we consider diabetic urgencies, meaning that they have to be seen quite quickly. A puncture wound actually introduces dirt deeper down into the flesh or the tissue of the foot. The foot is very complex in structure. There are multiple compartments. So if that puncture, say with a nail or a tap, introduces dirt or bacteria into a compartment, an infection can be set up and it can get out of hand very quickly, especially if your blood sugar is uncontrolled, and sometimes you don't realize how serious that infection is until it turns up on the outside. If the blood sugars are not controlled, the bacteria are going to get all happy on that sugar and they multiply extra fast. So please do not play with puncture wounds. Please present to a surgeon or to the hospital or get very good advice from your care provider on it. But puncture wounds actually need to be what we call debrided, or the tract needs to be taken out or excised, what we call like decorticated basically. Okay, don't mind the big words, that doesn't mean anything, but that puncture wound tract needs to be excised safely by somebody who's skilled at doing it, and they can make sure that they actually do it properly. If it's done but unhealthy materials are left back in there, you could be setting yourself up for a lot of trouble. Always check your feet daily. If you can't see the bottom of your feet, tie a mirror onto something with a long handle. If you can't actually see your feet, get somebody else to look at it. When you're going to put on your shoes, shake your shoes out, make sure they're not rocks, stones, anything like that in there. And of course, wear the right footwear. So thin slippers, ballerina shoes, and other sandals where your foot is overhanging or not fitting are not going to protect your feet from an unexpected injury. And likewise, when you're dealing with diabetes, too big a shoe is not always a fit. Sometimes that will cause excessive shearing and the same injury that you're trying to avoid. I want to just remind people, don't take your feet into your own hands, because if you present too late, you may present at a stage where you have either overwhelming infection that can't be controlled, or you may have so much tissue loss that you may have to have significant amount of tissue removed from your foot, or you may even have a bone infection. That is something called osteomyelitis, which is very, very, very difficult to manage, and you really don't want to put yourself at risk of losing a digit or even having an amputation. Also, please manage things like your corns, calluses, and nail issues regularly. Don't let them get way out of hand and then present late for care.
How long have you had diabetes, Deborah?
I only found out a couple years back.
So tell us about your experience at the Maria Holder Diabetes Center.
My experience is that from the time I've been out there, the foot began to improve a lot, heal and everything. It's very nice to me. I will ask anybody, I want the whole body to go to the diabetic center. And I find a lot of improvement with your feet. So I would beg anybody to go to the diabetic center.
If you are diabetic or pre-diabetic and listening to QFM right now, in 2025, Q stands for Quality Health Services at lower prices, which is what you will find at the Maria Holder Diabetes Center located in Warren, St. Michael. If you are looking for diabetic eye screening, vascular screening, podiatry, or nutritional advice, call 243-3937 or 417-0305 and make an appointment today. Don't miss next week when we will be dealing with more diabetic issues. Same Q time, same Q station. Compliments the Maria Holder Diabetes Center, the Barbados Diabetic Eye Screening Program, and the Barbados Community Foundation.
If you or your loved one is impacted by diabetes and have questions, the Barbados Diabetes Foundation has the answers.
It's always easy here to reverse diabetes, certainly control it properly and avoid complications if you at least know that you have it.
But it's just again to re-emphasize the importance of good diabetic care. And diabetic care involves really almost every part of the body. So it's your feet, your heart. But again, we're coming back to what our main focus is at this time is the eye care.